Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Undescended testis. So undescended testis, what is the location? The location is it can be inguinal or it can be palpable as well. So it includes the UDT, that is about 80%. Then comes abdominal, that is it can be non-palpable. This amounts to about 20%. Next is what are the risk factors? Risk factors, if you see, it can be due to the prematurity or it can be due to the LBW, that is a low birth weight. So pathology wise, there is a Leydig cells. So Leydig cells are present. They are less sensitive. They are less sensitive to the temperature. Then comes testosterone. This testosterone production, it decreases, and by 5 to 6 years, the complete absence of the spermatogenesis. Then there is abnormal germ cell histology. Now, what are the complications of this? That there can be sterility, there can be atrophy, there can also be the trauma, there is a tumor, there is torsion. The most common tumor, if you see, this will be the most common tumor includes the seminoma, and the maximum risk of tumor will be the abdominal, and it is greater than that of the inguinal testis. Then the hernia. The hernia, it greater than 90% cases have the patent process vaginalis. Then also there is presence of inflammation. Now next we look at the orchidopexy. Orchidopexy, it doesn't decrease the testicular tumor risk and facilitates the early diagnosis. Now what is the investigation of the UDT? This includes the inguinal exploration. Now investigation of the non-palpable UDT. This includes the diagnostic laparoscopy, as well as there is a start tracing the vas deferens on the testicular injury. If the vas deferens is blind, a testis may or may not be present. If testicular artery is also blind, indicates the testicular agenesis. So if testis is present, it is to perform the orchidopexy. Now let's look at the best age for the orchidopexy. So orchidopexy is 6 months due to the orchidopexy and should not be delayed, and this is by the 12 months. So what are the named orchidopexy techniques? It includes the Ombridanes. Ombridanes, then is the Keatley's toric, as a Stephen Fowler's, as well as the Ladd and Gross. Then the placing the testis in the Darto's pouch. Then comes the best results with the microvascular testicular auto transplantation. To learn and grow daily like this, please do subscribe.